Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa and today we're going to be going over Inadine. But first, if you could hit like and subscribe, it would be greatly appreciated as it does help my channel grow. So let's get started. So Inadine is a broad spectrum topical antimicrobial dressing. It's a non-adherent viscous sheet impregnated with 10% povidone iodine, which is equivalent to 1% available iodine. Indications for use. So we're going to use this on shallow wounds because it is just a sheet, so it doesn't conform well into crevices. So we're going to use this on shallow wounds that do show signs and symptoms of a local infection. So like I say in all my other videos, we want to make sure that we're treating infection. So if it's a topical infection or like a localized infection, we're treating it topically. If you have a more deep spreading infection, we are going to be treating that with an antibiotic, and just make sure you use your nerds and stonies to determine if it's a local or deep spreading infection. I do have a video on that. I can put it in the comments below just to determine between local and deep infection. But we only really want to use antimicrobials when we have an infection because it does cause some tissue toxicity, so we want to make sure that we are healing the wounds as quickly as possible. And I know a lot of people think, well, let's use an antimicrobial, it'll heal it quicker, but it actually doesn't. It does prolong it. Even if it's a few days, it's still longer. So if you don't have an infection, you want to be using a product that isn't an antimicrobial. You can also use this for maintenance or non-healing shallow wounds or prophylactically for wounds. So if it's in an area that's at high risk of becoming infected, you can use this there. Just some precautions. So we're going to avoid use on newborns less than 6 months old and avoid using before or after radio iodine diagnostic tests. We are not going to use this on anyone who has an iodine sensitivity or an allergy. We're not going to use this on pregnant or breastfeeding women, and we're not going to use this on During's dermatitis. So it's a very rare skin form. We're not going to use it on that either. Okay, so as you can see off to the right-hand side here, this is the patch here. So it does have a backing on both sides, this white backing. It just protects this from drying out. So you're going to peel it off one side and then peel it off the other side. Now, this can be cut to fit onto the wound, and it can cover the peri-wound somewhat. That is perfectly fine. So as always, we want to make sure we have a clean wound and peri-wound using normal saline or sterile water, and then just dry off your peri-wound area. And then just remember to remove both sides of the backing and apply the middle piece here, this brown middle piece, directly into the wound bed. Now we're only going to use one layer of the Inadine. Now if you find that it's sticking or getting stuck, you can use hydrogel just to make sure that it's not sticking, but most of the time it doesn't stick because it is a non-stick. And it can lift up if you just put some sterile saline on it on removal. And then you're just going to apply a cover dressing to maintain a moisture balance. So just use whatever type of cover dressing to kind of go with the amount of exudate you're having. So on removal, just carefully remove it from the wound bed. If you're having difficulty, like I said, you can either add a couple drops of saline. I've found that helpful, or you can take the dressing, so it's a square, and take opposite sides and just give it a gentle stretch diagonally from opposite corners, and it will lift up. Frequency change. So depending on the amount of exudate, the dressing can last up to 7 days. So there is a fade color indicator, as you can see right here. Okay, so it starts off orange and it does fade out to white when it loses the antimicrobial effectiveness. Okay, so that's when it should be changed. Between here and here, make sure you're changing that. And the expected outcome is that the local infection is resolved within 2 weeks. If you're using it prophylactically, the wound is not going to become infected. So that's all I have for this video. I hope it's going to help you in your clinical practice, and I will catch you in my next video.